We also have the ethmoidal notch, which is just going to be an indention, or it looks like a piece of the bone is missing in the frontal bone where the ethmoid bone will sit. We also have a supraorbital notch or foramen. So if we break that word down, supraorbital means above the orbit of the eye, and you'll see a hole, or sometimes it's also just a notch. So as we look at pictures here, we can see the hole above the eye orbit. So that will be the supraorbital foramen. We also see the zygomatic process of the frontal bone, and that is this portion of the bone right here. You can see it is a bump coming from the frontal bone, and then our zygomatic bone is going to be hanging out right about here. So the bump is heading towards there, so that is the zygomatic process of the frontal bone. So I annotate that with a Z. Now looking at a different view here, the ethmoidal notch is just this indention in the bone right here. And the ethmoid bone is going to be able to sit in that notch. So ethmoidal notch. Now from this picture, from this sagittal view, we can see the sinus or the air-filled cavity in the frontal bone itself. And that is the frontal sinus. Starting on the occipital bone, we have the foramen magnum, which will be the largest hole of the skull. So this is a really easy landmark to find. So use that to your advantage as you move around from there. We also have occipital condyles, which look like little pads, and they're actually going to be what is sitting on the atlas or C1 that we learned in Unit 2. We also have a pharyngeal tubercle, and if you'll recall from terminology, tubercle is just a small rounded process on a bone. It's also called the basal-occipital tubercle, and this is just anterior to the foramen magnum, which is a small little bump. We also have the external occipital protuberance, and you can actually feel this on yourself. If you feel the big bump on the back of your head, that is your external occipital protuberance. So this is another easy to find landmark to be able to use as you work your way around the occipital bone. The external occipital crest is going to be a ridge that's going to go from the external occipital protuberance all the way to the foramen magnum. Coming off this external occipital crest, we're going to see our next two structures, the nuchal lines. The superior nuchal line look like arches extending from the actual protuberance. And then inferiorly, we're going to have the inferior nuchal lines coming off that external occipital crest. They just look like little ridges, and these are where many muscles will attach to. Now, if we have an external occipital protuberance, if we have to indicate that structure is external, that means we're also going to have an internal occipital protuberance. So this will be a bump on the inside. We also have an internal occipital crest just going from the protuberance on the inside down to the foramen magnum, just like we saw with the outside. Now coming off internal occipital crest, we have something called the transverse sulcus. And this is a groove in the bone, and it's going to travel horizontally away from this internal occipital crest. And when we get to the veins of the brain later on, there's actually a vein called the transverse sinus that's going to sit in this sulcus. If you continue to follow this around, it's actually going to curve like the letter S, and that's when we call this groove the sigmoid sulcus. And again, we will learn a vein called the sigmoid sinus that will sit in this groove. Our next structure, the hypoglossal canal. This is going to be a hole that's actually going through the occipital condyles, so those pads. Again, when we get to cranial nerves, we have a hypoglossal nerve that will travel through this hole. So starting on these structures, we can see the foramen magnum, this big hole right here. And then we can also see the external occipital protuberance right here, this bump on the back of the head. Now going from there, these pads are going to be the occipital condyles, and we're looking inferiorly right now. Let's look at one more landmark as well. This will be anterior, so towards the front.